are a self-tracker. You presented on the panel, and you've been tracking your own symptoms for a long time. Can you tell us a little bit about your disease condition back when you were first diagnosed?
Sure. So I have myasthenia gravis, which is an autoimmune disease that causes weakness in mostly voluntary muscles. For me, this affects my face mostly. I have droopy eyelids, a weak smile. Sometimes I get double vision. I've also been taking steroids for a long time to keep my symptoms in check. And those steroids have caused a lot of stomach problems. And so that's why I started self-tracking just in the past, actually, 5 or so months.
Okay.
I've been tracking my food and then tracking my symptoms to try and figure out which foods are making me feel better and worse.
Yeah.
So, yeah.
And where did you get the idea to self-track? Like, did you hear about it somewhere, or did you find an app that you thought was great?
So I knew about it, and I just never had wanted to get into it. I thought it would be too much work. But I actually met some people who kind of convinced me to actually be a beta tester for their platform. And so that's how I got started with it.
Mm-hmm.
And so I got started, and I realized it wasn't as hard as I had expected.
Yeah.
So.
What sort of things do you track, and what device do you use?
I use my iPhone, and I have the app on my iPhone. I'm tracking the foods I'm eating and taking pictures of the food. I'm tracking how my stomach feels. I have some symptoms of burning in my fingers and my toes, and I'm tracking that. Those are kind of the primary, and my weakness.
Okay.
Those are the primary things. So.
Are you using a numerical scale, or?
Yeah, so we use a numerical scale 0 to 4, and 4 is severe and 0 is no problem.
Okay. And what has been the response of your physicians to all this data that you bring them?
Actually, I haven't brought them all my data. I did share a finding with my primary care doctor that fruit seemed to be making my burning worse.
Okay.
And she was interested in it. She was open to it, but I haven't kind of brought her my data en masse or anything like that. I kind of go in waves where I want to see a lot of doctors, and then I want to see no doctors for a while. So I've been in a anti-traditional medicine phase, and now I'm kind of heading back. So I've been seeing my primary care doctor again.
Okay.
So.
And I can imagine that if you're seeing multiple physicians, as you are for a complicated condition such as myasthenia gravis, that the clinicians it would be helpful for them to see your data and to kind of get a snapshot of how your disease has been going. Is that correct?
Definitely, yeah. I think if there's any way to bridge that gap between physicians, that anything patients can do, I think that's really helpful. For me, I've kind of jumped from doctor to doctor, and I found it difficult to have to retell my story every time, and I haven't been tracking for very long, so I didn't have a lot of data to share with them. So that is definitely a challenge when you're seeing lots of different specialists, and you feel like you have to kind of put the pieces together between them. So.
Yeah. And would you recommend other patients self-track? Has it helped you?
It's really helped me, yeah. I've learned some things that have helped me make slight behavior changes and kind of food changes that have definitely helped me feel better. So I think if patients have any kind of symptom that's unexplained, and if they suspect, food or exercise or sleep might be a factor, I think it's worth trying.
Yeah. And I'm just curious, what sort of apps do you use?
I actually am using an app called MyMe, and so it's a beta app right now. I think it's coming out soon, and it's just a way to kind of track specific things about your life, and you work with a health coach who helps you decide what to track. Because if you tracked everything, you'll get burned out really quickly.
Right, and it'll take a lot of time, I'm guessing.
A lot of time,
yeah.
So they help you kind of focus and decide what's important, and then they have a coach who actually works with you to help you understand your data.
And you were mentioning before that this has actually led to new understanding of your knowledge, or of your disease. Can you talk a little bit about what you've learned and what you've found just through self-tracking?
Yeah, so I guess the main things I learned were that, again, fruit was making me
Right.
feel worse. That garlic made me feel better
Oh,
in a lot of
interesting.
cases. Even my myasthenia weakness symptoms
Wow.
seem to get better when I eat garlic,
Uh-huh.
which is kind of strange. And then the other kind of big finding was that chocolate, which I love to eat, did not make me worse.
Okay, that's
So
good.
that was great because I was
That's
worried,
good news.
maybe this chocolate is not good for me, but it actually had no effect.
Oh, good.
Yeah.
Awesome. And I know we'll talk about this in a little bit, I think later when the camera comes in. But what do you see as the patient's role in healthcare and in providing healthcare for him or herself?
Yeah, so right now I think the patient role is like project manager. You are responsible, you need to be responsible for kind of owning your health story and knowing all of those details about what's going on with you, and distributing that knowledge as much as you can to all your different practitioners, healthcare practitioners. Because right now, I think that it's not really a patient-centered model of care. The patient is kind of on the periphery, and then there's all these doctors who don't really talk to each other. So the patient has to position themselves in the middle and make sure that information is spreading to all the different practitioners.
Right. I think that's absolutely right. Coming from a medical perspective, I know how hard it is to manage someone who is seeing multiple specialists.
Yep.
Because you only have so many hours in a day, and you have
Yeah.
to see other patients.
Yeah.
Really, patients are the ones who know their condition the best.
Right.
And so it makes absolute sense for patients to be at the center of that circle, as you were saying.
Yeah.
And I understand that you're also bringing your experience into your professional life as well. Can you talk a little bit about that?
Sure, I'm hoping to. So I'm a user experience designer, and
Uh-huh.
I've been working on designing mobile apps and websites, and I have been working for a big digital agency in New York, mostly on kind of large brands like Johnson & Johnson and Verizon. And I want to kind of take my experience and apply it toward healthcare. So I have an interest in data visualization, and I love my work as a user experience designer, helping to kind of design structures and systems and even interfaces that make sense to people and that are enjoyable to use. So I want to just take all of that and apply that toward healthcare in whatever way I can.
Right.
So.
And how do we get more patients to know about these apps that are out there? How do we make self-tracking more available to patients everywhere?
That's a good question. I feel like there are a lot of people who are tracking, actually, using food tracking, MyFitnessPal. I think that people are aware of self-tracking for like fitness and food. I don't know that it's become mainstream for like symptom tracking.
Right.
And I think part of that is there's kind of a scarcity of apps, really. There's one called Simple that's just come out, and that's a symptom tracker. And I think it's also part of the doctor's role to say, I want you to try tracking your food and tracking your
Right.
symptoms, and we'll see what happens. Bring back your findings. So I think it's really important that the doctor kind of take an active role.
Yeah, because I can imagine right now it's mostly the patient doing it on his or her own, and then the clinician just receiving the data and being like, oh, this is nice that you did this, but they don't necessarily recommend it for all their patients, which maybe they should for patients living with chronic disease.
Yeah, and even, sometimes when they get the data, it's like, okay, I don't know if I want to have to take the time to interpret this, because
Right.
sometimes the charts are extremely detailed, or it's difficult to kind of pick out those high-level findings when someone just presents you with this big graph or
Right.
something like that.
Yeah.
So
That's totally understandable. Well, is there anything else that you would like to share with us today?
I'm so happy to be here, and it just seems like a very supportive community, and with the e-patients as well. I think it's just very cool that this conference is really strong on the patient perspective.
Right.